Thank you, Mr. Chairman, for hosting this hearing on innovation in healthcare. Thank our witnesses. Mr. Gonzalez, thank you so much for being here. There's not a member up here, or probably most in this room, haven't been touched for Alzheimer's and the other disorders that really affect the livelihoods of our friends or our loved ones. So thank you for being here. As an engineer, I'm always fascinated by the incredible science and technology people are used to create life-saving medical devices and drugs. I want to thank my two colleagues, two doctors up here. They're expert witnesses in their own right, expert questioners who know what they're talking about, or been on the receiving end of this, have seen it. And I believe that, as I've said with many instances in Congress, we have a lot of people up here talk about things they know nothing about. And when you have people who know what they're talking about, it's refreshing. In recent years, innovative software technologies known as prescription digital therapeutics, PDTs for short, have come to the market. These healthcare phone applications are studied in clinical trials and reviewed by the FDA for safety and efficacy before they can be prescribed to patients in healthcare and healthcare providers. PDTs have been put to use in treating opioid addiction, veterans with PTSD, children with ADHD, and a host of other illnesses, including diabetes and mental health disorders. While the FDA has approved these digital health solutions, there are still roadblocks to widespread access. The current number of senior citizens on Medicare is estimated to reach nearly 61 million by the end of this year, and many of them have no access to these treatments due to lack of coverage from CMS. If America is to remain a leader in the healthcare technology and innovation, we must ensure that the FDA and CMS approval process for DPTs are in sync. That is why I, along with Congressman Mike Thompson, along with a couple of senators, introduced H.R. 1458 to access the PDT Act to allow CMS to cover PDTs. While I am on the topic of FDA and CMS synchronization, I want to echo the bipartisan support we heard today for the MSET rule and Congressman Winstrup's legislation to codify it. Our seniors deserve timely access to these life-saving breakthrough treatments. Today, I also want to discuss rare disease drugs and treatments. Earlier this year in a hearing, I shared my personal connection to the rare disease community and my concern about recent legislation discouraging innovation in this space. The IRA includes an exemption from the negotiation process for orphan drugs. However, the exemption is limited to orphan drugs that are only for one rare disease or condition. As many of you know, many rare disease drugs are often discovered as a second or third indication for a drug, as my colleague just indicated. It is clear the authors of this bill wanted to protect innovation in the rare disease space, but this provision falls short. I'm calling on my Democrat colleagues to work with me on a technical fix to the bill to make sure that more rare disease drugs and treatments are protected from the negotiation process. I was really encouraged in our HHS budget hearing when Secretary Becerra committed to work with me to ensure the rare disease drug pipeline is not damaged, and again, I really hope we can work on a bipartisan fix to this issue. I believe there is a middle ground we can find that prevents abuse of orphan drug exclusion, but also protects innovation. My question, I got two short ones. Mr. Mackauer, or Dr. Mackauer, can you comment on the impact PDTs are having on patients and the need for a clear path to reimbursement?
Absolutely. Digital therapeutics have a tremendous opportunity to improve patient outcomes and care. And it's very, very important that we find a way to cover these technologies for patients. The fact that they're being currently sort of in a box, unable to be reimbursed because of a technicality, is really a problem and needs to be solved, and we really need some modernization around the entire benefit category process.
Thank you. Dr. Lakdawala, can you comment on the recent changes to rare disease drug policy and what impact do you anticipate?
Sure, thank you, Congressman. It's likely that there will be reduction in innovation in rare disease because follow-on indications are now potentially penalized under the IRA. It's also the case more generally there will be reductions in incentive to innovate. It's notable, though, that rare disease often features very high unmet need for patients. And as an economist, I can tell you that that means the value of any given health improvement is greater because patients have so little health that even a given relatively modest improvement of health can be quite valuable. That needs to be accounted for in the way CMS sets maximum fair prices to at least mitigate some of these issues for rare disease where value is at a premium.
Thank you for your responses. And again, thank each of you for being with us today. Mr. Chairman, I yield back.